Hi, my name is Hunter, and today I will be performing the sterile dressing change on a central line. So before we get started, I would just kind of run through. I don't have any jewelry on, no bracelets, no hair ties, etc. My hair is back. I have my school badge and school appropriate scrubs on. So kind of diving into the skill, I'll just kind of walk through what I have. I have my skin here. I have the tegaderm already placed down with the catheter and the clamp at the distal end here. And then I've got clean gloves, mask, pen, and then I've also got my sterile kit, sterile dressing for my central line change. Okay, so first thing is we're going to walk into the patient's room, introduce ourselves to the patient, ensure patient privacy, identify the patient using two identifiers, explain the procedure to the patient. We're going to go ahead and do a central line dressing change on you today. Instructing the client to either A, turn their head to ensure they're not coughing on the site or touching on it or touching it. And then also just letting them know it's going to be a sterile procedure, so try to avoid touching it or anything of that nature. We can also just provide them with a mask as well. So can also provide them with like a mask, like I said. So before we go ahead and start the procedure, perform my hand hygiene. Again, I'm going to place a mask on myself and then either ask the patient to look away, but also providing them with a mask as well. Okay, and then we are gonna go ahead and put on our clean gloves here. And the first thing we are gonna do today is we're going to remove the current dressing that is on there. And we're gonna start with, just to note, like I've gone through so much tegaderm from doing this skills quite a few times now. So I have like the small tegaderm on there because that's all I have left. And that's what I'll be using in my sterile packaging as well. So, okay, so securing the catheter with my non-dominant hand and then trying to peel up all four edges first. Okay. And then once we get this pulled off, we are going to, again, corners, all four corners, and then we're going to be pulling straight up parallel to the skin once we get it closer to the middle here. Stuff is so sticky. Okay, and then straight off. Okay, great. Now I'm going to dispose of the old dressing. Okay, now we're going to want to then inspect the catheter itself, checking the integrity of it, ensuring that it's not broken, there's no cracks, kinks, etc. Then we want to check the immediate skin where the catheter is inserted, checking for any edema, purulent drainage, irritation, etc. Also asking the patient if they're experiencing any discomfort, pain, itching, etc. And then we also want to check the surrounding skin as well. So everything looks great. So I'm going to go ahead and remove my gloves, my dirty gloves. Okay. Disposing. And then I'm going to perform my hand hygiene. And I'm going to move into the sterile procedure. So I'll go ahead and do my hand hygiene. Okay. Move this over a little bit. Now I'm going to, when I'm opening this up, I'm going to ensure that I am opening it away from myself, not cross-contaminating, not reaching over it, like such. So, okay. And again, this thing does not like to stay down. Okay. Gently grabbing my sterile gloves. Okay. And when we are applying our sterile gloves, we always want to ensure that, I'm just gonna scoot that way. Ensure that we only are grabbing the 1-inch border to open the sterile gloves like so. Okay. Now I'm just gonna gently grab the cuff here, thumb out, ensuring I made my sterility. Okay. Grabbing under the cuff here, thumb out again, and ensuring that I made my sterile gloving. So now I want to keep my sterile gloves here. I don't want to drop my hands or touch anything that's going to cross-contaminate and or break sterility. I'm going to gently move this over here. Okay. Now what we're going to do is we are going to go ahead and cleanse the area. I'm going to grab my chlorhexidine, and for the sake of the video, I'm not going to pop it, but we'd pop this and then allow the chlorhexidine to fully absorb. And when we are doing the cleansing, I'm going to grab the forceps and I'm going to hold the end of the distal end of the catheter. And we are going to clean each site or around the site for 30 seconds, causing friction. Now, if I was to be using alcohol wipes, I would use a circular motion, but we're using chlorhexidine. So I'm going to grab my forceps here. Okay, I'm going to gently grab the catheter here. Again, not tugging on it, pulling on it, or causing any distress to the patient. So we'll go ahead, 30 seconds, 30 seconds, 30 seconds, 30 seconds. And then I'm going to want to come from the IV site to the distal end, cleansing that. Okay, underneath. And then again, IV site to the distal end. Okay, great. Now we're going to go ahead and gently place the catheter tip down. Okay, and disposing of those. Right, now we're going to go ahead and allow that to dry completely. And as we go ahead and do that, I'm going to grab the Tegaderm for the bandage. And again, like I noted, I only have the small Tegaderm left. So this is literally all I have left in my skills boxes. So I'm going to go ahead and place this on the patient. Okay. Right. Okay. Alrighty. And then I'm going to make sure it's all covered up. And then there we go. Okay, and then I'm going to grab the label here, like so. And then I'm going to initial, date, and time. And then I'm going to take the label off and place it on the site, but obviously not over the IV site, because we want to ensure that we can see that. Okay, like so. Okay. All right, now I'm just going to clean up my supplies here. And then I would remove my sterile gloves. Okay. Okay, perform my hand hygiene, ensure the patient was okay, and then ask the patient if they need anything, give them the call button, and then I could leave the room and document the procedure.